guys, women at the front lines. My name is Madreen, and I hope you are doing well. Yes, it is already the festive season, December. A lot is going on, but I hope everyone is well. Yes, so join me, welcome our guest today. We have a special guest in studio today. She's a very busy woman doing a lot of community work, and I know many of you have seen her where she's doing her work from. So we are really privileged to have her in studio today to share about, of course, herself and more about her work. Winnie, you are very welcome.
Thank you very much. Very good afternoon to you, dear viewers. My name is Winnie Nabukeera. I'm a young nurse, a social entrepreneur, a mentor, a coach, and a speaker.
Wow.
I am the founder, Littleweed Foundation, a social enterprise that provides continuous professional development courses for healthcare providers with a key interest in soft skills, entrepreneurship, and work readiness programs. I'm happy to be here.
Wow, wow. And I like the way you're dressing.
Thank you.
Signifies the work that you're doing.
Oh, yes.
Yeah, thank you so much for coming.
You're welcome.
Yes, and she has said a lot about herself in brief, what she does, but we are here to know more about who Winnie Nabukeera is. Yes, take us back those days. Who is Winnie Nabukeera, childhood experience, and of course your education background?
Amazing. Thank you very much. So Winnie Nabukeera grew up from very humble beginnings. I grew up from a village in Masaka, deep down in Masaka.
Okay.
So I must say that my humble beginnings have been able to humble me, but also enable me to do work that I do. I was born and raised by my mother, who is a nurse. And I must say that for the work that I do, I found my mother to be a role model and an inspiration, because I must say that seeing her wake up every day, go and open up her clinic every day, go and serve patients, deliver mothers, treat people that are sick. I must say that she taught me the values of compassion, of serving others when they are very helpless. So she gave me the skills. And from that time when I was young, I definitely knew I am going to be a nurse. And guess what? I am here being a nurse and getting out of my comfort, getting out of, thinking beyond the hospital walls and serving community. So I started my education background where when I moved from the village, I came to Kampala. I think to those of you that know that if you have been born and raised in the village and then you're hearing about Kampala, of course you're excited. You're coming from the village, and definitely you're a villager. So you come in Kampala. So when I came in, I joined a Mengo School of Nursing and Midwifery that gave me a lot of skills that nurtured me as a young nurse to be who I am today. I also went and studied from Ekure, Mengo, where I did my diploma in ultrasound, and I got skills in imaging and radiology. Then after I joined Aga Khan University, where I got a lot of skills that enabled me to learn more about patient care, understand clinical setting. And I must say that it's been very incredible going through these institutions because they have shaped me as a young nurse. And I believe that because I've been mentored by the best, taught by the best, that is how I'm able to do all these amazing, impactful works in community.
Wow, amazing. So Winnie, growing up, which kind of child were you?
So Winnie was a very quiet, I must say, a bit quiet, reserved, and I feel that is I am still today. Yes, but very enthusiastic to learning, very open-minded, and very intentional about life. That was Winnie, and still I am today.
Wow. All right, Winnie, so tell us more about, this work that you're doing, your career and profession as a nurse.
Yeah, amazing. So when I joined the nursing school, I was very intentional to growing myself as a young nurse, but also asking myself, what kind of impact did I want to make in community? I just didn't want to be like a normal nurse, waking up, get off from home, go to hospital, get off from hospital, go back home. I didn't want that, kind of routine. I wanted to be that impactful nurse that goes beyond the hospital walls and does amazing things. So when I qualified in 2019, those are the kind of questions that were rotating in my mind. And guess what? That is where my idea of a Little Win Foundation was born. So given the fact that I used to interact with patients in the hospital, when we used to go to community, I kept asking myself, what is it that I can be able to do so that services are closer to people in community, people are more aware about their health, and they can make intentional and informed decisions about their health. So we started a Little Win Foundation in 2019, and we did a lot of education in HIV, sexual and reproductive health, where we did a lot of, engagements with students in learning institutions, people in community, to help them to understand and make informed decisions about their health. And we also did a lot of medical camps, a lot of sensitizations, and all of that. And I must say that I started Little Win Foundation without business knowledge or guidance, but I'm happy to tell you that we have been able to grow as an organization. And definitely so many people keep asking me, why is it that your company is called Little Win Foundation? I was a little and a young girl that was very enthusiastic, passionate, energetic. And I said, why not? Let my company be a Little Win Foundation. And looking at how far we have come, and actually we are celebrating 6 years of community impact. For me, I feel it is definite progress. It is definite purpose and passion that has enabled us to grow from where we started to where we are. And I'm happy to report to you that we have been able to rebrand Little Win Foundation, and now we are a social enterprise that is committed to providing continuous professional development courses for healthcare providers with a key interest in soft skills, entrepreneurship, and work readiness programs. So being a young nurse, I looked at what is the gap that I can be able to solve in healthcare? And of course, that was the knowledge and the skills gap that so many times in our trainings, we are given a lot of, technical skills, but you realize non-technical skills are not actually taught. And when you qualify, it is actually your non-technical skills that push you further. And there are very many studies that have been made that 85% of job success comes from soft skills, and only 15% by hard skills. And that is why, as an organization, of course, through the different programs and projects that we have done, we said, okay, in our rebrand, let us focus on those three thematic areas and see how we can elevate the status of nurses and midwives, of healthcare providers, to help them to maximize their potential, to get out of their comfort, add value to themselves, but also impact their communities. So when you look at the soft skills training package, we address key areas of communication, which actually affects quality of care. We help professionals to learn how to communicate, to learn how to have empathy, to learn how to be creative and innovative, to learn how to be problem solvers and critical thinkers, but also to have motivation at heart. And then also looking at leadership, those are all different soft skills that we teach these professionals. And the beauty about our programs is we deliver them both virtual but also physical. So someone is able to do this program wherever they are, using their Zoom or Google Meet. We share with them the links and they're able to do them. But we also deliver these training programs physically, where we go to these healthcare organizations and be able to mentor and guide and empower their staff to make sure that they're able to we are able to enhance quality of care in our facilities. And I must say that this is one of the best decisions that we have made, because we feel that impact is there. The gap has been there, but we are ensuring that we are able to empower the providers to stay relevant, to have value, to love their profession, but also be able to, have the patients at the center of our work. But also looking at the part of entrepreneurship, we have a lot of unemployment in healthcare. I was actually looking at the statistics on the Uganda Nurses and Midwives Council, which says that we have over 70,000, plus nurses and midwives that are registered. But when you look into the employment portfolio, we have over 20,000 plus nurses and midwives that are actually employed, actively employed. So the question is, where are the 40,000 or whatever number of nurses and midwives? Where are they? What are they doing? So realize that we actually have a lot of unemployment, and that is why, as an organization, we are very intentional about nurturing and building sustainable healthcare solutions that solve community challenges. So we want the healthcare professionals not to just wait for patients that, come and seek their services in these facilities. We want them to go to their communities, to health educate people, to have impactful initiatives and projects that are able to drive the cost of care down, have patients at the center, empower communities to live better, to observe their nutritional, intakes, make better informed decisions, maintain hygiene and sanitation. We want them to get out of these facilities, to go back and educate people. So we nurture that, and this is also a comprehensive package program that has different modular trainings, and we take these professionals through right from idea generation up to the launching stage. And we help them to learn how to do digital marketing, proposal writing, look at their business plans, pitch decks, and all of that. But also lastly, looking at the work readiness programs, we realize that still during our trainings, we are not prepared for the life after school. So someone graduates, you're not oriented on how you can even showcase your value, on how you can, bargain on your paycheck and all of that. So in our work readiness programs, we help the healthcare providers to be job ready, to overcome the different complexities of or even the challenges in the healthcare space. So we tackle issues around CV writing, interview preparation. We take them through job search strategies. We connect them to jobs. We help them to be able to brand themselves, to be able to showcase their value, even virtually, because for us, we believe that actually social media is someone's online CV. So when someone goes to their maybe social media platforms, what is it that they find on their, WhatsApp, on their LinkedIn, on their X, Facebook, Instagram, and all of that. But you also teach them about etiquette skills, things like dress code, things like public speaking, things like, personal branding, and many of those. And we must say that we are very happy about work that we have done. We've had an opportunity to collaborate with different healthcare institutions, learning institutions, and it is very, very amazing to see that we are helping healthcare providers to elevate the status in the healthcare fraternity and space.
Wow, that's quite a lot from Winnie, Little Winnie Foundation. But Winnie, when did you mentioned you started Little Winnie Foundation in 2019. How do you start this? You're still a young nurse right away from school. How do you start this? And was there anyone behind you to have this venture?
Wow, that's amazing. So I feel, to me, it was really passion. I had passion to serving community. I just didn't want to be a normal, a casual nurse. I just didn't want to do that. I wanted to position myself as a go-to person. I wanted to be a person that is known for something, and being known to be somebody is asking yourself, what problem can I be able to solve?
Yes.
And for me, it was passion. And when I had to, of course, put my experience, my knowledge and skills, that is where the birth of Little Win Foundation came to help and support communities. Yes.
And you mentioned, supporting communities. What is that biggest gap that you identified as a person, as a young nurse, that you think was mainly affecting people in communities that Little Winnie Foundation came to, give support and aid to these communities?
Yes, amazing. Of course, when we talk about community is large. It is large. Given the fact that I am a young nurse, I resonate 100% with healthcare providers. And I feel that much of my work, actually our niche, are healthcare providers. These are nurses and midwives. These are allied healthcare professionals. These are, non-clinical staff that interact with patients, but we also serve the young people as well. So we had to ask ourselves, what is the gap that we can be able to solve in healthcare? Of course, we have challenges around communication, challenges around attitude and mindset. We have challenges around, communication and leadership. And that is where our soft skills training programs, our entrepreneurship training programs, and our work readiness programs help to support and bridge many of these challenges that we have to help the providers improve their skills, nursing skills, enhance customer care, and also satisfaction that later on supports and promotes healthcare outcomes. Yes.
And through these trainings, you mentioned about the impact you've been able to see, how good Little Winnie Foundation has done in society. Can you tell us about, some of the things, the good things that you feel Little Winnie Foundation has done, mainly with the healthcare providers?
Awesome. So looking at Little Win Foundation at 6 years, I feel it's been a blessing. And number one, we have seen our work evolve day by day, and I'm happy to tell you that our impact has reached over 1,500 healthcare providers in this country. And for me, it's super amazing. And we are visioning Little Win Foundation to reach every healthcare space in this country, to reach every healthcare provider in this country, because we believe that soft skills are very integral, very critical in the work that we do. And given the fact that these are things that are not even taught in classroom, in households, in our different, learning spaces, we believe that everyone needs them. And that is why our impact has so far been able to reach to 1,500 professionals, and we hope that we, through partnerships and collaborations, we are going to reach every corner of this country. But also looking at providers being able to...
Winnie, before you go on, you keep talking of soft skills. Someone who doesn't know what soft skills are, which kind of skills do you, give to the healthcare providers?
Amazing. So soft skills, these are character traits that help us to work harmoniously well with those that are around us. And these skills include communication, attitude, leadership, emotional intelligence, critical thinking, creativity and innovation, motivation, time management, and many others. And these are skills that help us, even when you're not a healthcare provider. How do you relate? Oh yes. How do you relate with those that are around you? How do you carry yourself? And many of those. Yes.
And how is, the perception so far from the people that you train, the healthcare providers, about this? Because one would think that, when you're studying nursing, these are things that you should know. Customer care, how do you handle patients? Yes, but we've seen many cases where, you visit someone and nurses are really not bothered. Mainly I'll talk on behalf of the women, you go to the labor ward and then nurses, are toiling you here and there. They are not bothered. So what is the perception or the reception of these soft skills, mainly to the people that you offer them to?
Amazing. So the perception now, we have done a lot of advocacy, I must say, and now people are really trying to appreciate the value and the impact that soft skills have towards accelerating the quality of care in our facilities. And I must say that they are really embracing them because they have been able to recognize that this is a gap that we need to bridge. And now the purpose of the trainings is how do we help them to adopt the soft skills on top of their hard skills. And these are simple things. As a mother comes in to, maybe they are going to deliver, me are putting on a beautiful smile and you're telling them, hi, you're welcome, how are you doing? I'm here to support you. You're going to actually allay their anxiety. Me are soothing them, soothing on their back. And you're like, you know what, I know this is a tough, experience, but I'm here for you. And then you're showing them that empathy. You're showing them that actually you're the boss, you're welcome. That is what our clients need. And I must say that people have tried to embrace this, and many of the providers that we have interacted with, they are saying that this is a game changer because they thought that actually their technical skills maybe 100% ready, to take them on a higher level, but they have been able to appreciate that with soft skills, you can go further, you can go far, and actually soft skills are now the new hard skills. But also looking at the impact that we have made, we have seen a lot of providers get into leadership, enhance, client satisfaction, improve quality of care in these facilities, enhance their confidence and esteem skills. And that is so crucial because, confidence comes from being competent. Many of them have been able to accelerate their confidence skills. They can speak up. They can, articulate issues in a well-organized manner, courtesy of the trainings that we have made. And we are very happy about that.
Wow. And as Little Winnie Foundation, you mentioned you want to reach everywhere in Uganda. How is this possible? Who is behind Little Winnie Foundation? The funding, because is it, do you have support from the government? Because this is something that all hospitals, all healthcare providers need. Who is supporting Little Winnie Foundation, and how are you able, to move around hospital to hospital?
Amazing. So one of the core values of Little Winnie Foundation is strategic partnerships. We are very open and intentional to having partnerships with different stakeholders, with different ministries and also organizations. And that is Ministry of Health, the different healthcare organizations, the different learning institutions, and also communities in general. We believe, as Little Winnie Foundation, I was looking at, the huge numbers of healthcare providers that we have in the country. Definitely, Little Winnie Foundation doesn't have all the resources to be able to reach to all these, facilities and these providers. But we believe that through partnerships with these different stakeholders, we can reach every corner of this country. But above all, we have an incredible team of amazing, team staff that support all these works. I don't do this work alone. They're very young, passionate about change. And these are nurses and midwives, these are doctors, these are allied healthcare providers that are saying enough is enough. We need to do better. We need to have our clients in the center of the work that we do. And they are doing what they can to empowering one another, inspiring one another, so that we can change the image that we have in healthcare and people can appreciate the value that we bring to the table.
So Winnie, you're doing a lot of work, but someone will ask, how are you able to do all this? What makes you relevant in the health sector? Yes, and maybe share some of your work ethics that you think have kept you so strong and consistent with Little Winnie Foundation.
That's amazing. Thank you very much. I believe that staying relevant requires continuous learning. It requires flexibility and adaptability, but also, you know, keeping with the trend. So as Little Winnie Foundation, we are very intentional about that, but also being able to seek mentorship and guidance. I don't do this work because I know it all. Not. It is because I have a team. I have very many mentors that I so many times sit down with, share my aspirations, share my dreams with, and they're able to help me to shape them better. And I really want to applaud and appreciate them very much. But also being able to have a committed team that you know, not only does the work only for revenue, but they're very passionate about community transformation. For me, I feel that has been able to keep us stay relevant in the work that we do. And one of my work ethics or my ethics has been shaped towards integrity, compassion, but also excellence. I love to do excellent work. I love to do work that leaves a legacy, that leaves a mark wherever that we go. And this is actually portrayed through the different high-level, quality, and impactful trainings that we have given to all the different organizations that we have worked with. Yes.
Well, and Winnie, you talked of mentors. Which people do you look up to? And you, your pastor, you yourself, you're also a mentor. You're mentoring young people. Yes. Maybe you'll speak to the young people if you want to, you know, discover what you want to do. How do people discover themselves? Yes, in that line of mentorship.
Wow, that's amazing. And I'll kindly mention two people that have really shaped me so many times. I share my ideas with. One is the CEO for St. Francis Hospital in Zambia, and that is Dr. Andrew Sechtoleko. He's been very fundamental. I remember years back when I went to his office, I was a young and a little small girl, but was very intentional and very strategic. I went to his office and I told him, Doctor, I appreciate you for the work that you're doing. I want you to be my mentor. And he was very surprised to see a young nurse that is very confident, seeking mentorship and all of that. And he said, Winnie, why not? And I must tell you that he's been able to guide me so many times when I want to do something. Of course, I consult from him, and then he advises me, and that is where we are able to do work that we do. Another person is the Vice Chancellor, Clark International University. That is Professor Dr. Rose Nanyonga Clark. She is an outstanding nurse global leader. She's very, very awesome. She's been able to grow her career from being a nursing assistant to being a professor. To being a professor, growing from a nursing assistant to being a professor. For me, it is. I mean, I can't even imagine. And for me, I feel she's a very inspiration to very many nurses out there to aim higher, and her story is a game changer. And I want to appreciate them for the work that they do, but also giving me part of their time to mentor me and to guide me together with all my other mentors. So how does someone discover themselves? Discovery starts from self-awareness, understanding who you are, understanding the impact that you want to make, understanding the legacy, understanding how you want people to remember you, understanding the problems that you want to solve in community. For me, I feel it starts with self-discovery, self-awareness. These are the people that come in. They're just going to help you to nurture what is already in you, to guide you, and that is how it starts.
So we need someone who is watching us will want to know, you're doing a lot of amazing work, moving up and down. How are you able to do all this as a young woman?
That's amazing. I know and I recognize and appreciate that work that I do sometimes is challenging,
Yeah.
but I am a kind of a person that is able to prioritize my tasks. I'm able to set clear goals. I make time to rest and recharge and renew my energy. And every time you see me, I'm happy, I'm excited, I'm grateful, I'm ready to do work that I do. And that is how I'm able to, you know, keep on my game, encourage myself. But also the network of people that are around me are very positive. They encourage us, and we do this work together, and we encourage each other, and we keep it up, really. Yeah.
And you also mentioned, you know, you get some time off.
Oh,
The
yes.
nurses also get some time off.
Oh, yes. I feel that work-life balance is something that is
Yeah.
very important.
Yeah.
I think earlier last year or this year, I'm not forgetting really, I took my first trip to Dubai, and it was super amazing. You
away
know,
from
oh
work.
yes, oh yes, getting up and, you know, chilling, you know, seeing the beautiful city, going for all these rides. I feel it is something that is a very, very amazing. And you know, sometimes it is very fatiguing. You know, you have to stand, you have to talk, and I'm just imagining, and so many times you even go to hospital, you have to work and all of that. I feel that work-life balance is something that is super needed in healthcare. Oh yes.
True. And Winnie, what are some of the challenges that you know you encounter when you're doing this kind of work? I know you cannot do this, you know, on a smooth surface.
Yeah.
There are issues that come here up and yes. So what are some of these issues?
All right, so I know that as any other organizations, challenges are usually there. One of the challenges that we have faced as Little Win Foundation is the limited resources, because our vision is to see that our programs are embraced. They are taken to every healthcare provider in this country. Because if we are able to do that, that is how we are going to keep changing the attitudes, the mindsets of these providers, to have their patients and clients at the center of their work. And that is how we can be able to transform the image in the sector. Of course, financial resources. We want to reach to every provider, but sometimes we are limited. And then also the digital challenge. So many times you see that our programs are delivered both virtual and also physical. We have had different healthcare providers without smartphones. They don't have internet. And realize if we cannot be able to reach them maybe physically, we cannot do it virtually because they don't have internet, they don't have smartphones. And then it becomes a challenge. But also looking at the different maybe scalability and sustainability. So many times as a company grows, it is a lot of things that, you know, a lot of commitment, a lot of things that have to be done and all of that. So we feel that maybe sometimes we are limited a bit.
And Winnie, so away from the challenges, what are some of the opportunities you think that, you know, have come with Little Winnie Foundation, but of course you, that with the work that you're doing within the amazing within the healthcare providers, what are some of the opportunities that have come your way as a person, and of course also with Little Winnie Foundation?
That's amazing. So one of the opportunities that we have is we are seeing a growing demand of healthcare training with a key interest in soft skills, entrepreneurship, and work readiness programs. So people are now getting away. We are getting, you know, woken up to understand that actually we have done a lot of technical skills, but now actually the soft skills, the non-technical skilling is a game changer in the work that we do if we are to be able to elevate the status and the quality of care in these facilities. So there is a really growing demand, and for us it is an opportunity, but also partnerships and collaborations. As I emphasize that we are very intentional about that, and we are open to collaborations with healthcare organizations, institutions, communities, and the different stakeholders so that we can be able to pass on these trainings. But also looking at the growing need for the new market, LWF can be able to collaborate with anyone as long as their objectives are in interest with what we are doing, and we can be able to support, collaborate, guide, and see how we can be able to work together. But also we have a different diversification of different revenue streams. For example, yes, we do all these trainings, but we also do a consultancy for companies, for organizations and people. We do counseling and guidance. We have and run short courses in professional caregiving where we teach people routine basic care management, and this cuts across to the 15 standard modular trainings in caregiving where we help them to advance in terms of, career opportunities, be able to embrace and do things that are very passionate about. And this could be maybe taking care of the elderly, the children, the vulnerable, and the sick in general. Yes.
All right. And so your impact when you're working, with healthcare providers, how big has your impact been?
Yeah, so as I earlier on shared that our impact has reached over 1,500 healthcare providers in this country. But we are open to even reaching every healthcare provider in this country, right from a low level to a higher level, right from urban and all those rural areas.
All right. And Winnie, what are some of the lessons to the young people? Mainly a young woman who would want, who is looking up to you and is, inspired by the work that you're doing. That young woman who wants to be a nurse and is stranded maybe somewhere. That young woman who has not yet, discovered themselves. What are some of the lessons or advice or encouragement can you give to the young women in Uganda?
Amazing. One of the lessons or the advice I can be able to give to people out there is believe in your dreams. Believe in your abilities, believe in your passions. No one is going to get you out of your comfort. You are going to get out of your comfort by sharing your experiences, your knowledge and skills, finding a problem and being able to solve that problem. All of us can impact the world. And I believe that the greatest way to leave a legacy is to empower, inspire one another. And when we do that, we create a world that empowers, that inspires, that brings all of us together to add a stone to one another. All of us can make it. You and me can make it.
Wow. Okay, beautiful. And Winnie, as we come to the end of the conversation, where do we see Little Winnie Foundation in the next 5 years to come?
Great question. We envision a Little Winnie Foundation to be a one-stop CPD center, a one-stop continuous professional development center that offers top-notch soft skills, entrepreneurship, and work readiness programs that elevate quality of care globally. So that is where we want to see LWF go in the next, I don't know how many years. And we believe, because we are very passionate and committed about community transformation and all the works that we do, this is going to be achieved. Together with your support, we know we can be able to get far, and through partnerships and collaborations, we can turn the world around.
Wow. And so far, Winnie, anything else, what you'd want to share with our viewers, something special about your work, anything?
Wow, that's amazing. I must say that it's been a great opportunity speaking to you. I feel so privileged, and thank you very much to all our partners and stakeholders that have been a part of this journey. We shouldn't have gotten this far without your collaboration, without your support, without your guidance, without having LWF on board. So we appreciate you very much. And if anyone is watching, I'll keep emphasizing we are open to strategic partnerships and collaborations. Let us take this on a higher note, on a higher level, by putting up resources together, mobilizing different stakeholders to come on board to see that this idea, this vision thrives up to when every healthcare provider is able to have their patient at the center of the work that they do. They're able to, enhance and grow personally and professionally. So thank you very much, and I will be happy to hear from you, to network and be able to collaborate with you. Thank you.
Wow, it has been amazing here with Winnie from Little Winnie Foundation. I know many of you have, seen her do a lot of amazing work, and we are really so happy that she took, some time off from her busy schedule to come and speak to you, share about her work, and of course about herself as an individual. Thank you so much, Winnie, for coming through.
You're welcome.
It has been an honor, and we wish you the best at Little Winnie Foundation as you celebrate your 6 years of existence, and we hope to see more work from Little Winnie Foundation.
That's amazing. Thank you very much for having me.
Yes. Thank you so much to our viewers. You have been very lovely viewers. Watch all our episodes on Civic Space TV and follow all our social media platforms. I've been your host, Madreen. See you next week. Bye.